In every community, there is work to be done. In every heart, there is the power to do it. Nearly 1 in 5 people under the age of 65 are without health insurance in America. In Wisconsin, a state that is doing better than most, 12% of our citizens go without coverage, and in Jefferson and Dodge Counties, 13,000 of our friends, neighbors, and family do not have health insurance. You are probably asking yourself, who are the uninsured? They are not very different than you or I. 80% of the uninsured are adults. 80% are either workers or live with workers. 67% are from families earning less than $40,000 for a family of 4. They work for small companies that can't afford to offer health insurance, or they can only offer insurance that is very costly and out of reach for many. They are part-time workers or self-employed. They are between jobs or just out of school. 29% are between 18 and 29. They don't sound that different than you or I. In 2006, a number of our healthcare professionals, along with the Dodge-Jefferson Healthier Community Partnership, came together to do something about this problem. They had seen the faces of the uninsured and knew that something had to be done. They believed that the Watertown community would come together to help their fellow citizens in need, and that a clinic to help the uninsured was feasible. Together, they formed the Watertown Area Cares Clinic Committee. Their belief in the Watertown community was well placed, and in May of 2008, the Watertown Area Cares Clinic opened its doors, providing uninsured residents with access to health care.
When we started to dream about a free clinic in Watertown, we had no idea what the community support would be like, and we were overwhelmed. I think that there are very few people within our community that don't recognize the value of this clinic. It is really widespread appreciation for the service that comes from this clinic, and that's from medical professional people, as well as a lay person who doesn't have an idea about the traditional medical care, business people, just civic-minded individuals. It's outstanding.
This place has far exceeded my expectations. Our location is perfect. Our clinic is inviting, and it's a healthy place to be. It's a place that people want to come to volunteer, want to come for their health care. We're really lucky. We're really lucky to have that, and it's all from the generosity of the people in our community.
Well, it's been a tremendous experience watching the contributors to the process here. My small part as a clinician, helping with the design of the clinic, really lent me an opportunity to see the great contributions of all the tradesmen in our community and the commitment of people like Harley Harold from the hospital, who contributed untold hours to the process of making this building happen. The finished product speaks for itself in that I don't think anyone would doubt this was a first-class clinic, and I think it's our commitment from the community that we're able to pull together, with all their help, a clinic that's just first class for our patients who don't have the ability to pay for those services.
The fundraising wasn't going as well as we thought it would, so I got involved. I have a lot of contacts with contractors. So I started calling people and just talking to people, and I found that people were willing to step up and really give on their time, as well as their their gifts in business. I was amazed, because I started calling these people and discussing with these people about what was going on and how important it was, and they all seemed to step up. Never done this before. I was always involved in, okay, let me give you a PO number, and the company comes in and says, okay, now I'll come in and for this much money do your job. And whenever I talked to people, I got on the phone and I said I had to precursor it with saying, I got to ask you a little other question that I'm for free. And once we got into conversing and discussing, and it was a community event, and how it helped all people. It wasn't just a few people who were going to benefit from it. It wasn't a big business that was responsible for it, but it was the community. These businesses all stepped up.
I guess I have just been really excited about the community support. I've heard so many things no one really knew what the community would do for us, and they have come forward. Not only have the construction people put this all together for us, Peg Theater was huge in actually giving the warm environment, and she still watches over all the details to make sure everything is just so. But then from all the other members of the community, I mean, every which way, people have come together and said, what can we do for you? How can we help?
The first job that I had was to look at the project as far as the space planning was concerned. I worked closely with Harley, Harold, and a number of other people to determine what needs there were in specific areas and how we were going to make them most comfortable for the staff as they were working, as well as the patients. The next step after planning and replanning, and we basically started to get the word out. Carol did a wonderful job with advertising and telling people that we were in need of furnishings. At that time we had a good idea of what furnishings we were looking for, and some wonderful people in Watertown were able to donate so many different items that really made a difference in this whole project.
Working together, medical professionals, community volunteers, businesses, and community organizations donated their time and resources to help open this state-of-the-art medical facility.
Patients have been very favorable about this, and I think that it's wonderful that we can see that they realize all the contributions of the different people who have made this happen. From walking in the door, to what's in the exam rooms, to having their needs met. And it's been nice to change my hat from that of a person helping to develop this to a clinician helping to serve those needs now.
Some of them cry when they see it. That's the initial reaction. We had an 18-year-old who was brought in by her grandmother. She doesn't have insurance, she has diabetes, didn't know what she was going to do about her medications, and when she saw how beautiful the facility was, she burst into tears and said, "This is a real live doctor's office."
Every day, new patients find the Watertown Area Cares Clinic. They are surprised and delighted by the facility and the care they receive. Many return to volunteer.
I just thought, you know, there's this feeling when you can't work, you know, when you don't have a job and all that you're not worthy, and it starts to, you know, really get at you. And there are a lot of people like me that, you know, do what you can, you know, to make money and this and that, but we don't have insurance. And more employers are, you know, stopping that or putting all the expense onto the employee.
I didn't realize how easy it was to fall through the cracks until after I had lost my employment and the health benefits. So I think that's very important for that, because there's a lot of people out there that probably could use it that don't know about it too.
In January, my husband lost his job, and I was laid off in the middle of May. And so neither of us had insurance or income coming in other than unemployment. I take numerous medications. I have a lot of medical problems. And my pharmacist kind of noticed that I wasn't getting my prescriptions filled anymore, and she questioned me on it. And I told her that I just didn't have insurance and I couldn't afford to do it. And I do it at a grocery store is where my pharmacy is. I was in the store shopping, and all of a sudden somebody tapped me on the shoulder, and it was my pharmacist who came and gave me a telephone number. And she says, "Call this number, they'll help you." And so I did, and I set up an appointment. They got me in a very short time. I think I called one day and came in the next day. They were just super. They were kind and considerate. They didn't make me feel like I was a loser, which, you know, I was beginning to feel like.
The first part of our mission has been completed. The clinic is helping hundreds of citizens find the care they need, but the job is not finished. As we all know, the clinic has monthly costs that must be met. Although all but one of the staff are volunteers, there are monthly operating expenses to cover, as well as the high cost of medications.
A big part of our role has turned out to be looking at the medications people are using, helping them to find the lowest cost alternatives that work for their medical condition, and then helping them get access to those medications on an ongoing basis. One of our biggest risks in healthcare right now is the fragmentation of availability of either physician or provider resources, or in this case, medication resources. And I really see one of our big tasks is helping to buffer those bridges of time when people don't have access to healthcare dollars, and trying to meet those needs by finding what can work, getting them access to it, and getting them consistent drug access until they're available through their own insurance again.
Well, I'm hoping that we are going to be able to meet all the medical needs of these people. And I believe that ultimately prevention, if we can teach preventative measures, these people will be far more healthy, and it will impact our community in a much greater way.
There's a lot of ways to get involved. Certainly there's certain skills that we are always going to need here at the clinic, that more than just people who have healthcare experience. People who have any skills that can contribute to running an office are good. We are always looking for ways to do fundraising, and there's countless opportunities to be involved in that way. We're always looking for ways to recognize our volunteers, recognize the people who have given so much time and effort already. And I think that if someone was willing to, or someone wanted to help out or be a part of this, we'd have no trouble finding a way that they would find enjoyable and interesting and really helpful.
It's a chance to make a difference. It's a chance to help people who may not otherwise get help. It's just a good experience to feel that you've aided somebody in their recovery.
It gives you such a good community feeling to be there helping someone. There's a lot of people out there that just don't know what to do with their time, and if they were to come in and volunteer even an hour or two a day, that would be great.
So I asked them whether I could volunteer and be a translator or any help they wanted, because I was looking for jobs. I was in a transition time. I just actually finished my master's degree in microbiology, so I said, in the meanwhile I can volunteer until I find a new job and actually help for a good cause.
By helping the Watertown Area Cares Clinic, you are giving a gift of hope, not to a stranger, but to a friend, a neighbor, or a family member. Organizations have pledged support in establishing and sustaining this clinic. The City of Watertown and the Mayor have pledged their support. Many citizens have given of their time and talents to make this dream a reality. Can we count on your support to continue this mission? No donation of time or money is too small. Please help.
Give what you can, give of your time or money, anything, and makes Watertown a better place.
Possibilities are endless as long as you have enough people in a community that care. Yeah, we have a facility here. I've been pulling numbers together a little bit that the construction probably runs in the realms of $200,000 plus, and we were managed to put it together for I think around $30,000, and all because of the community gave. So to me, it's amazing.
We're making differences every single day, helping people get back, return to work, be better parents, be better citizens, and it makes Watertown a better place to live and to be part of. And with the community's continued support, we'll be able to provide this valuable resource in the community.
Well, I just think that this is something that was a dream for many people, and with that dream, we were able to all pull together and to coordinate our efforts in a wonderful manner where everybody seemed to have a little different expertise. And with that power, we were able to achieve something that I think is going to be beneficial for Watertown for many years.
In every community, there is work to be done. In every heart, there is the power to do it.